Hello everyone and welcome back to the MedBoys channel. My name is Rushal and today I have with me Nimit and Naman. Nimit is in his second year at U of T Med. I'm in my first year at U of T Medical School and Naman is an incoming medical student. So today all three of us are going to react to Grey's Anatomy.
By the way, guys, we've never watched this show before. This is a bad idea.
I hate the show. The house is so much better.
I've seen a couple of episodes, so I'm not gonna lie. I think it's got a good sort of balance between medicine and romance, at least in the first
Good
season.
balance?
No.
I mean, from what I've seen.
Yo,
No,
start
no.
watching.
Alright, man, alright. What is she doing?
I have no idea. Oh, bro, I would click off at this point.
Okay,
What's
first of all,
going on?
I'm kind of confused. So the title is Meredith Grey Gets Attacked by a Patient. So I guess she's checking his vitals or something, and then he's waking up right now.
Yeah, she did a very fast abdo exam. I saw that in the middle where she was trying to palpate, but she did it in 2 seconds, so I don't know what she actually learned from this.
Lou? Lou? You need to lay down. You shouldn't be up. Let's get back on the bed, Lou.
You're 2 years into medical school. Tell me, are you allowed to put your hands on a patient that much?
Well, I mean, I think she's just trying to be gentle with him. She didn't push him or anything. But I feel like she should have heard him get up.
Yeah.
The beds are pretty squeaky.
Yeah.
It's not like this guy's James Bond or something. He's gonna sneak up behind you.
See, this is what I hate about shows like this. They develop a villain out of a patient.
I also don't understand. She has outer protection on. And she has no gloves, and she's touching the patient like that. So I'm confused. Originally she had gloves on. She was touching the patient. Now she's comfortable not touching the patient with gloves. It doesn't make any sense.
And
to
no
me.
mask either.
Yeah.
Because she's wearing the gown probably because of aerosol or droplet protection. And she doesn't have a mask on.
Hey,
Ethan, charged for 300.
Charged.
All right, ready? Clear? Come on. All right, clear?
But the major thing these shows get wrong is if your pulse stops, shocking you won't do anything. Because the shock is meant to shock you back into normal rhythm.
True.
Okay.
So these guys, the pulse goes away and then they shock them and the pulse comes back. But that's not how it works.
But guys, I have a defibrillator at home.
Really? Why?
You want to see it?
Yeah. Oh my god.
Oh my god.
You know, by the way, that actually works.
Really?
I had a cardiologist who said that if you have an abnormal heart rhythm, let's say there's no defibrillator, right? One option, this is the worst option, but you could punch them really hard in the chest and sometimes it comes back the rhythm. I'm not even kidding. Search this up.
I actually believe you because I feel there are a lot of different ways that I've seen to restore someone's heart rhythm that you normally wouldn't expect. So basically, what I learned about just through a case report was apparently someone's atrial fibrillation was in effect, and apparently through a digital rectal exam, the AFib actually went away. So it was pretty cool to know that something like a DRE could stop a patient from having AFib.
It is just a case report though.
I need some help in here now!
Trauma panel sent blood for a cross match. Belly is soft.
Bruising on the left chest. Decreased breath sounds on the left.
Hard line is going in. Pulse ox is down to 88.
For trauma series, hook up those monitors.
You need a wide bore IV.
Get ortho here to add some left arm and leg.
So in this situation, at least it seems like the patient had a seizure, and then afterwards, I think because of the seizure, he was able to have some violent tendency. So in a case where a patient attacks a doctor like this, and it's simply a result of their medical condition, as far as you know, what actually happens in that case?
And I'm pretty sure you can use like a chemical restraint. Like if they were attacking you, you could inject them with like something to make them go down. Although it's not advised like all the time. There's also this form specifically that you fill out when something like this happens that forces them to stay in the hospital and they don't get discharged even if they want to.
That's interesting.
Yeah.
I think another like sort of defense mechanism that these hospitals actually implement is on your ID badges, the actual lanyard can detach. So if a patient tries to like yank your cord or strangle you with it, the cord will, or the actual lanyard will detach. So for example, if I'm wearing it and someone tries to yank on it like that, it just immediately clips off. So if a patient tries to attack you, they can't do anything with, by trying to yank on your lanyard or strangle you or anything like that.
Yeah, and also like back here, there's all these codes. Yeah, so you can see a code white is a violent person. So you can call that and the security comes right away.
Good to know. Good to know, incoming medical student.
Veins collapse. I can't get in.
Burn a central line.
I got it. Oh, okay. Obvious dislocation of the left elbow. We got some left knee swelling.
Rib fractures on the left with palpable crepitus.
Get ortho here. Have a leader of bringers on stand.
Need a whiteboard.
In trauma situations, Rochelle, here, this is a test.
Right.
What are the 3 things you look at first?
ABCs.
Yeah, so what are the ABCs?
So the airways, the breathing, and the circulation.
Yeah, so what did they do for airway right here?
So I guess they've found that her airway is compromised, so they've got her on like it's just like sort of face ventilation.
Yeah, and then they're putting the line in for the circulation,
Yeah,
and the breathing's still going on.
Yeah.
And like the collar you see over here, that's to make sure that the spine at the back here isn't injured.
Right.
Because anytime you have an injury where you can injure that, they just put it into the spine and they keep you in it until they know that there's no definitive injury, because that can be really bad.
Okay. I mean, it seems like from what they're saying, like Meredith's condition is pretty bad in this case. I mean, she's got like multiple IVs in her. She's got a central line. She's got a rib fracture. Like
Dislocated elbow, yeah.
oh yeah, exactly.
Incoming medical student, what do we do next?
She's dead.
All right.
Meredith, it's okay. It's okay. It's okay. It's okay.
We're here. What have we...
Possible concussion, head contusion, multiple blunt force blows to the head and neck. It's great. I'm sorry. I thought you knew.
Dr. Shepard? Dr. Shepard. Dr. Shepard.
Here's the films. Pressure's 90/60.
I think that's his sister, bro. Because like he's like,
It's Derek, right? It's Dr.
Yeah.
Derek Shepard,
I thought
right?
it was like some guy named McDreamy or something.
I think it is. I don't know. I don't know who that is. An imposter or something.
Okay.
She's got a 30% pneumo.
No obvious effusion.
She needs your chest tube.
36-2 betadine and 6.5 gloves.
Put up the floor back.
Just got labs. Crit is stable.
Good. Draw blood gas from the A-line.
What is this? What the hell happened? She was attacked by a patient.
Okay, no, I have to stop this here. There's so much going on. Isn't this bad for the patient?
No, it's
There's
pretty
so
normal.
many people.
It's pretty normal. Like generally in trauma situations, there's one like trauma leader. So there's always like a designated trauma leader.
Yeah.
And then that person will be like, okay, you're doing IV, you're stabilizing the head, you're taking care of breathing. And then those guys are doing their individual jobs. And then the trauma leader will be at the top, making sure everything is happening.
Okay, but like how clean is this environment? People just walking in, walking out.
Yeah, well, she's gonna die if like you don't do stuff fast.
The thing is though, the risk of like potential infection, like it's high because she's got like lines in her and stuff. However, like the number of people doesn't change that because she's not really got any open wounds as far as like we see from this. So like
Makes sense.
yeah, that's the thing. And like he said, like it's important that a lot of people are there.
It's fine.
Here we go.
Tube is in.
Easy. Those folks coming back up. 88, 90.
No evidence of traumatic brain injury. No focal deficits. Except, Dr. Gray, I need you to move your fingers for me.
How has she just determined that there's no traumatic brain injury without any scans? Is that possible?
Honestly, I'm not sure. I haven't gone through my neuro block yet. She just tested like her pupillary reflexes. So
Yeah, like she was doing a few things. Like she made her follow the finger. She made
okay,
us, like,
that,
but like I mean, you can't like fully rule it out. I'd say.
yeah.
But like we're not doctors yet.
and yeah, by the way, guys, there's a lot going on in this section, so it's kind of difficult to break down everything. But in general, what they seem to be doing is literally what Nimit said, like trauma, care. So that's ABCs, putting in like central lines to make sure that she's sort of getting all the necessary sort of like nutrients, electrolytes, whatever, like fluid resuscitation and all of these things.
Yeah, I will say when they made the incision on the side here and they put in the chest tube, that looked pretty real.
Yeah.
Because we just did that.
I was gonna say, like, as much as I hate this show, they don't do a bad job. Like,
this is
showing
not
this.
bad.
Yeah.
This is not bad. Yeah.
It's not bad. But again, this is the first clip we're watching, so.
For me? Or your toes? Come on, wiggle
She
something.
responded to the painful stimulus. Guys, I don't think she can hear us.
What?
What, are you sure?
No. Mayor?
Are you sure that's not the boyfriend?
No, okay, so basically she does have some sort of injury.
Yeah. She can't move her
Yeah.
toes, so it's some like spinal cord thing.
She can't hear either.
Yeah. So she probably did injure her spine.
Yeah.
At the back here. Let's see what happens.
Have to trach her.
No. All right, wait a second. If I can reduce the dislocation, we can probably get her mouth open just enough to intubate. It's gonna hurt like hell, though. Okay, hang tight. I'm sorry. Here. Okay, Mayor. Okay, we're gonna have to pop your jaw open, okay? I'm sorry. I know, but we have to do it. We're gonna do this on the count of 3, you guys. Ready? 1, 2.
Yo, that was crazy. I'm not gonna
That was
lie.
a pretty good clip.
Yeah. You know what this made me think though? Like, imagine what happens to our like favorite UFC fighters.
Oh, dude.
Like, these guys, after like even winning a game, they probably go through so much therapy just to get out of it.
So now we're moving on to the next clip, guys. Removing half a brain. So all of a sudden, the same ER doctors are going to be neurosurgeons.
I appreciate this. The chance to scrub in on this kind of procedure is, well...
Oh, that's...
Yeah.
That's him, right? That's the main man right there?
Yeah. So that guy, I forgot his name.
Derek,
I always forget his name.
Derek Shepard, no?
Derek is the guy behind,
Yeah.
but then the other guy, he's like, I think they're interns in this case, in this scene.
Wait, but isn't he
No,
the attendant?
This guy is an intern.
Yeah.
The other one's attending.
Yeah, he's like the
That's
neurosurgeon,
McDreamy.
right?
Yeah.
Hey, princess. You ready to take a nap?
Hey, look what I blow
I like
bubbles.
your little
That's
hat.
it.
Yeah, just breathe in. Oh, that's it.
What? Do you smell...
Smell what? Can't have a mask.
I'm sorry, Dr. Taylor, but did you just... Have you been drinking?
I beg.
Casper scenario.
Oh my gosh.
Casper
Yo,
scenario.
This is crazy.
So in this case, okay, so for those of you guys who don't know, Casper, situational judgment test, assesses your responses for ethical questions. These are actually, this exact scenario is a practice question for a lot of interview questions, Casper scenarios. So he's confronting the doctor, asking him if he's drinking. It's crazy. He's an intern. He might lose his...
As our expert right here in Casper, the most recent 4th quartile scorer among the 3 of us. What do you do in this situation?
You see, I'd be very hesitant in speaking to the doctor because they're my superior. I recognize the power dynamic between us. However, I do understand that the patient's life might be at risk. And for this reason, I'd want to speak to the doctor privately in a non-confrontational and non-judgmental manner. I can keep going, but I don't want to make this boring.
Well, it takes a lot of guts, though,
Oh, yeah.
to say it to his face. It's going to, like, fire him right away.
He's an intern, too.
Yeah.
Like, it's crazy. God.
Dr. Taylor! Oh, God. Sorry. I'm on it.
He was right, wasn't he?
I'll be fine. It won't happen again.
Yeah, not in here, it won't. Let me explain.
It's fine.
No, there is a code among doctors. We're not supposed to ask each other questions, not within the walls of this hospital.
Okay, I was out of line.
No, you weren't. I was. I was out of line. Somebody should have taken responsibility, and it should have been the guy doing the cutting. It should have been me.
Is this really going to happen? Attending, apologizing to a
Well, you
resident.
can have a good doctor like that.
What I'm actually curious about is this code he's talking about.
Yeah.
I don't know what that is.
Yeah, I don't know. I haven't heard of that.
Like, if it's a professional, like you might be risking a patient's life. What do you mean? Like, of course, doctors need to ask each other.
Yeah.
Like, I don't get it.
It's just too extra.
Yeah,
It's
just
like the mob
dramatic.
rules, where you don't snitch on anyone.
Yeah.
This is like the first clip I've seen of Grey's Anatomy without the girl in it.
Yeah,
Like,
these were
yeah.
2 good clips.
Yeah.
There's no romance. They're not like doing anything. It's all medical.
Yeah.
Show might be worth watching.
Yeah,
now.
might have to start it today.
So come on, let's go tell Jamie's parents she's going to be fine, barring any complications.
Oh, she showed up again.
So guys, that's the end of our Grey's Anatomy reaction video. I don't want to speak for all of us, but I'm pretty sure that we all actually enjoyed this, especially the ER one. The ER one was really intense. Exactly.
I'm about to go to sleep.
This guy's already got his fake stethoscope here. Well, anyways, next up, we're going to be watching Good Doctor for our future videos, all right?
Dr. Han, I am a surgeon.